Absolutely. All right, so going back to Cynthia giving the nod to competition and choice. When we were building the Granite List, I know I mentioned earlier that Al Lewis is a dear friend and mentor of ours. I think most everybody on the call has gotten to know Al Lewis, who is the chief Quizify. He is the founder and creator of Quizify. Also,
he was at the conference this week in Washington, D.C.
Okay. So then everyone, that Cynthia, that name is recognizable to you. Okay. He said, I don't want you to put everybody on the Granite List. I want you to only put validated solutions, the ones that you work with, on the Granite List. And you can imagine, those of you that know Al, curmudgeonly, not wanting it to be all things to all people. And I said, well, Al, that's the purpose of the Validation Institute. That's the purpose of Next Gen Solutions. It's the purpose of Health Rosetta. All of these wonderful organizations that have a subset of either preferred vendors or point solutions that have achieved certain outcomes. We want to be open table. And the only way that open table works is you have the really crummy Italian restaurants pitted up against the really great Italian restaurants, but both of them are there for searching and sourcing. So that frame of reference is what I wanted everyone to kind of come to this discussion with as we go through these. And so it is a marketplace, a database. We're not selling anything. We are simply a resource, an educational resource for our users. And we published a survey that we used really to help us give validity to why we were doing what we were doing. We know that advisors are swamped. One, your big mandate is to go out and prospect for new business, but you're also expected by your existing clients to be on top of every trend, every new solution, every new digital wellness app that comes into the marketplace. And generally you get those calls and questions at 4 o'clock on a Friday, and it's impossible to keep up with. And of course, we're starting to see a resurgence of conferences and face-to-face opportunities. But what we had found when we did our survey is that had been the primary source for brokers looking for new solutions. Referrals, far fewer of them used databases for searching new solutions, but they all researched reviews before recommending new solutions to clients. I know, again, over the pandemic, we've seen this rise in influencers and influencers playing a role in decision making. And so we are leveraging that and leaning into that. I love to tell the story about our name, why we went with the Granite List. The Granite Cutters Union was the first group in the United States to offer sick benefits to their members, but it wasn't just about offering sick benefits. Remember, our company name is Connect Healthcare Collaboration, and we love the idea of community and support and collaborating with one another. The Granite Cutters had kind of a very positive spin on, if anybody watched Bridgerton, the town newsletter. They had this newsletter that was published, and if you had a colleague that had needs beyond just their sick benefits, if they needed additional funding, if they had a spouse that had a young child that was needing additional support, you could take their story and submit it to the newsletter. And so they rallied around their own to help get each other back on their feet. And so we hope to instill that same sense of community within the people that are using our platform. You'll hear more about that in early 2023, but it is a very important part of what we have built up to this point. Well, we're taking community even further. We have resources right now that help bridge the gap in the community space. So it is, like I said, we have all these analogies, to give reference to help people understand what it is and how to use it. It's Angie's List meets Consumer Reports with the breadth and reviews of Amazon, all for the benefits universe. We want point solutions and vendors to be on our site to level the playing field. I always laugh because one of the first solutions that signed up for the Granite List was Virgin Pulse. Now, we all know that Sir Richard Branson and his team at Virgin and all the massive marketing that they have behind Virgin Pulse do not need the Granite List in order to get their brand out there. But they realize that this is how people make informed decisions, these types of platforms. And so they were one of our very first early adopters. For brokers and employers, by using the site, we hope to help educate on the solutions that you may not have heard of. Again, that competition and choice, leveling the playing field and helping you find new solutions that your plan members need the most. I'll pop into the site in just a little bit, but it's it's a pretty straightforward, kind of like a LinkedIn on steroids. If anyone works with vendors that they want to learn more about how to create pages, I'm happy. We have an awesome customer success team to really dig into it. But the same for brokers and employers. It gives you the ability to search, sort, source, read reviews, and learn about industry news through our weekly newsletter. Before I dig into the site itself, here's my ask of you all. You all are thought leaders, and we rely on our network and our universe to help share the best point solutions in the business. I've been taking notes as we talked just today on solutions that either I don't know about, or I'm assuming no one else on my team has heard of, although we do have over 2,000 solutions in almost 300 categories on the site. But there are 1,000,001 out there, and we want to be a mouthpiece for all of them. We need you to help make referrals to us, to also follow us on LinkedIn for the Granite List. You will find news related to the Granite List on our LinkedIn profile. If you follow Connect Healthcare Collaboration, that is broader, our all business lines news. I also hope that all of you are already receiving our newsletter, but if you're not, we have a weekly newsletter put out, educational content, as well as other interesting news that we find through our partner channels. We hope that you'll use the site and provide feedback to us. It is an open source platform designed for the consultant broker, the employer, and the point solution universe. Unlike other platforms out there, we do not block anyone from viewing the other's profile and information. And while that was important to us for it to not be gated or guarded once you created a profile, what we didn't realize was how hungry point solutions were to help find one another, because that doesn't occur on other platforms, and they are able to find partnerships to either expand into a new business line, to find cross-channel partners, to find new friends to meet up at conferences. And then also we have a podcast, so I ask you to tune into our podcast, which is called The Granite List Live. Before I jump into the site, any questions about what it is and how it works?
Anybody have any questions for Sally?
Sally, Cynthia, thank you so much. This is exciting. Do you see yourselves almost like the Angie List type of thing, where for access to vetted, cost-saving, transparent solutions?
We are moving towards having tiers of or categories where we are able, so we do not want to get into the vetting and validating ourselves, because we feel like that would step on some of the toes, like the Campbell Institute on the work comp side, Validation Institute on the medical plan. Well, they do medical plan and work comp side, but we've been so embraced with such open arms by some of these really great existing validated platforms. We're going to be incorporating also in early possibly by the end of this year, at least in the early part of 2023, the ability for someone to come on and, oh my gosh, what is it? Filter down to that level. So we don't see ourselves, we see ourselves as an aggregate, not somebody who would actually do the validating. Does that make sense?
Sorry, yes, of course it does. Thank you.
Yeah,
Sure.
Sally, so I have a little bit of clarification question on that then. So
Sure.
if you're aggregating the data, are you then vetting who the criteria in which the validation criteria is being used? Like what criteria is the Validation Institute using? What criteria is XYZ using? Are you going to be doing that? Or are you just going to say they've been validated by this institution?
Yes, the latter. We'll be providing that level.
I know the Validation Institute posts on their website each of those cases that they validated and goes into explaining how, what the criteria was.
Yes, exactly. And most of the point solutions that have been validated, well, all that I have seen that are on the granite list are also posting their annual validation reports. So it's available. We're more a marketing mouthpiece for them as the ability to bring them together.
Makes
You
sense.
just said, I
Makes
had something, but I'll jump into the site and then we can
And while you're doing that, Cynthia, I do want you to take a few minutes, maybe towards the end, to talk about this new service that you're developing where you go out and actually help employees in the decision process. Remember you were talking about how you were doing that for a couple of employers?
Sally or me? So you just
Did
mentioned
I
my
say Cynthia? I meant Sally.
name. Yeah,
Sally,
okay.
do you remember that conversation we had where you're starting to go out and actually provide some support to
for
employees?
enrollment.
Yes.
Yes, we can definitely.
I wanted, because that's a big part of what I just presented in Washington, was if we could get people to support people in the open enrollment process, build a relationship there, then we get over the hurdle of engagement. Because relationship has been proven to be the most effective way to do healthcare. And yet we don't use relationship like we should.
You're exactly right. So why don't I spend a few minutes on that, and then because I know several of you on the call have already perused the granite list before, so we can do a little show and tell for that at the end. We thank you for the opportunity to talk about all the fun things that we get to be involved in. And Daryl's absolutely right. We launched the enrollment and engagement services again out of this seeing from where we sit. So remember, I did not grow up in the benefit space. I've just been married into it for 25 years. And I worked for one of the largest regional banks in the United States, or certainly in the Southeast. And yet, we weren't well educated on how we made decisions. So thankfully, my husband, who was not the broker of record on the account, would come up to my department and he'd conduct a little mini lunch and learn for my team to make wise decisions. But as we grew our company, I've had the fortune of luring over a woman who ran FedEx's benefits analysis, and she was an accountant prior to that, and we saw that there's just, to Daryl's point, there's such a gap. Again, we've got these great ideas, these great solutions, but unless the employee understands what they are to do with it, it doesn't matter. It could be the best, the best return to work for cancer survivors solution in the world. But unless that cancer survivor knows about it, they won't use it. And so Daryl caught me kind of in the middle of us, boots on the ground, sitting alongside. It actually was, ironically, with a hospital system that is a safety net hospital, and sitting alongside, a 61-year-old man who has worked at this organization perhaps for 20 years and is making $34,000 a year. While that's not considered working poor, I think all of us would agree that as we near retirement, we hope we're netting a little bit more than that. And so just the opportunity is so real for people. 48% of the working population in the US is classified as working poor. So the vast majority of them do not have access to laptops and access to this fabulous site that we've built on their behalf. They barely can use a smartphone some of the time. And so that in person, the ability to connect on a very personal level, the ability to educate and explain and take time has been really important to our team.
And my opinion is that is the future of how we get over so many of the hurdles in healthcare. We make it relationship based. And
Yes.
ideally, the person who's helping you through that initial process is also there to help you navigate in the future. To me, it's all about relationships. How do we build relationships
100%.
systematically into the enrollment process and to the plan?
100%. And simply by, I laugh because we walked away from last week we had a couple of new employees who said, I never expected to get hugged so many times from these people that we enrolled, thanking us for just taking a few minutes to explain to them. And I think that's, I know for groups like Quizify and other groups that I care a great deal about, that it is you've got to have a good mix of education and, like you said, that personal engagement, because without it, we're just a whole bunch of apps, commandeering the World Wide Web.
Right. Well, and it's an incredible value add to the employer who's purchasing it. Because if the number one thing right now, and it's only becoming accentuated, is retention, and they have people through the health benefits that they know, they have a relationship with, they trust, it's like, I don't want to leave that. I don't want to leave that relationship that I've built relative to my health plan. And so I have to think twice about whether I want to leave this employer. So it just adds a stickiness to the employer's job of retention and retaining good employees. Exactly.
And it was an amazing experience for all of us that Daryl caught us in the middle of. It's nice to be thanked for the job you do. And I think, unfortunately, that in the benefits arena, we all hear about the bad a lot, especially from those of you that are client facing, when something goes wrong, when something doesn't work, when something gets denied. And it was a refreshing experience to be in the middle of a lot of chaos and that not happen. Yes.
Awesome. Who's got any questions? We've got a few more minutes. Anybody have any questions for Sally? I'm going to get you two mixed together. Sally.
This is Steve. I'd just like to say that I don't have any questions, but I think the things you're touching on now are, I'll say, really powerful. I think it's really an opportunity to make a difference. Just wanted to add that.
Thanks, Steve.
And I don't really have a comment or a question either, but my comment is around the ability for us as consultants to validate that any of these given service providers or point solutions themselves are valid. there is so much junk in the healthcare marketplace that even the Validation Institute struggles validating in a credible manner that actually, I've recently had discussion with Vidar about, how they created their purchasing guide, for example, for PBMs. The PBMs that are listed there, none of whom would ever pass muster with our consulting team.
Mhm.
And, I'm on the advisory board and it creates a lot of consternation on our part when, there's some of us that know what we know, and it's very difficult to, bring that to the surface in a credible manner where you're not really discouraging people.
Mhm.
And plan sponsors are quite honestly, they're being abused by their brokers and their consultants because a lot of them rely on information that's just really not valid.
Mhm.
And they themselves don't know how to validate it.
Yeah. No, good points.
And, and the hard part though, Daryl, and this is where I totally agree with you, because so much of our business is relationship driven. People develop relationships and they don't know better based upon what's going on and the actual solutions they bring to their clients.
Exactly. Yeah, no. I think you saw when I did my presentation, relationships exist in healthcare. It's just the
Oh,
wrong place.
It's very hard, and I've been in the business for almost 40 years now, and I look back at, my son, for example, he's 32 now, and he's been in the industry for about 8 years. And, had he not had me helping mentor him along the way, he'd be making the same mistakes that I see 98% of the consultants and brokers out there making today.
Well, and that just makes me think about, in the last 2 weeks, I've sat down with 2 of my young adult children who have said, Dad, I have this enormous benefit booklet from this company that I just started working for. Please sit down with me and help me understand it. And my thinking is, we got to make this simple. The more we can
Yes.
build relationships and make this simple, the greater the retention power of health benefits for the employer.
But isn't that intentionally part of the whole process? I mean, even people I know going on Medicare or Medicare Advantage have to hire a consultant to figure out what boxes to check and how to sign up. I mean, think about intelligent people, MD, PhD, hematology oncologists, bone marrow transplanters, okay? That, are top guns in their peer-reviewed world call me saying, I understand why you're doing what you're doing, because my 26-year-old son is a ski instructor in Colorado, and I can't figure out to help him with choosing a health plan, on the exchange, right? Like, what do you do? And she goes, I work for the Dana-Farber and Brigham, and here I should know, but has no clue, and tries to figure out what a mammogram costs for her breast cancer patients and can't get into that access for what cancer therapy costs, 30 years as a hemonc, not knowing the modalities and what the prices are. So, I mean, you think about enrollment, engagement, when you have really strong intellectual people not being able to figure it out, that's just a crime, because the cartel, I call it the cartel, has made it so much this way that so many middle players have to be hired. And quite frankly, just even going to your model, Daryl, of telling people they can pay cash, the employers give up. They are trying to get access to their health claims data, which is by law under the Consolidated Appropriations Act. The Blues block or the Aetna's block, it's so hard for them to get access to parse the data. They, after months of trying, then they have to realize they have to hire an ERISA lawyer to go after their rights. And then they don't want to get in a dogfight with people they sit at ball games or at their country clubs with. So it gets very, very hard because of these intentional barriers. And I just throw that out there as we have to catapult beyond them.
And Cynthia, I would even submit that part of the barriers that the carriers put up is for their own protection. Again, I'm going to go right back to the consultants and the brokers that are in the market. 99% of them have no clue what to do with a data set that they would get from a Blue or an Aetna or a Cigna or a TPA, and they don't have the resource on how to warehouse it, and they don't have the resources on how to do the analytics around it. So in somewhat of a conundrum that's been created in the marketplace, there's so many brokers and consultants, and this goes even for the big houses, that all they are is product people. And they don't really consult. They basically sell products. And then when all of a sudden they say, well, now I'm empowered by the CAA, I want to get this client's data and we're going to warehouse it. They don't even know what a warehouse looks like.
Yeah.
And then once they get it, what do they do with it? So, you know, the carriers are in a way in a really tough spot because they're also protecting themselves. And they're protecting themselves from the monsters they've created, which is this brokerage distribution channel that exists in the marketplace.
That was so well said, Scott.
Well, you know, I've been at this a long time. I
He's
tend
not
to
one
try
to
to
mince
cut to the
words.
chase. But yeah, it's very difficult. I mean, the team that I'm on, we're very blessed because we've been doing this type of data warehousing and analytics for 25 years now. We get it. We've had to go through all of the vetting that the carriers have put us through to basically say, are you all worthy and can you actually handle this? And once you get to the other side of it, of that abyss, it's very rewarding, but there's very few of us that actually exist in the marketplace. And, you know, my biggest problem is I don't message it well.
Well, and I've said this before, Scott, but you know, kudos to USI, who has been willing to say company-wide, we adopt this idea of working for the client company. And our allegiance is to the client, and our commissions and our bonuses are tied to the client's successes. I mean,
Yeah.
that's the way it should work. That's the gold standard.
Mhm.
And there are very few that actually do that.
You're exactly right. And that's what I have to remind myself to stay in my lane because I like to, I have lots of opinions about lots of things, but you know, Cynthia, to your point about like people not understanding. I mean, I'm fortunate enough to have built my career around when I worked at HGTV, I didn't get the fun, you know, decor and all the, you know, neat interior design projects. This was when the World Wide Web was moving from green screen to actual pictures. And I was put in charge of building and remodeling because they said, if you can understand it, you know, if you can write instructions and information in a way that you can understand it, anyone can. Because it's out of your wheelhouse. Same thing. Then I went to AutoZone, and despite, you know, my demure appearance, I'm no car, you know, car expert. And same thing, if you can understand it and put content in a way that our store managers can explain to the hourly high school student that's working, then they'll be able to understand. And then again, the financial industry. So it was easy to jump into the healthcare space because I felt like, well, at least I've had to listen to it for 25 years. So I apologize. I am supposed to be speaking at something else right now.
I'm going to say goodbye to everybody. I think we're a little over. Thank you so much, Sally, for joining us today. And please join us in the future. I say the same thing to all the rest. And again, thanks, Cindy. It's good to see you here. And it was so nice to meet you on Monday. Scott,
Thank
love
you.
your input.
Thank you,
Everybody have a
Scott.
good one.
Thanks, everybody.
Thank you very much.
Thank you.
Bye now. Have a great weekend.
Later. Bye.